Thank you so much, Professor Mehmet. It is great pleasure and great honor to give a lecture in virtual world spine. This time, everyone, good morning, good afternoon, good evening, everybody. And I'm Hyun Sung-kim from Nanuri Hospital from South Korea. This time, my lecture is the advances in endoscopic spinal decompression. And this is my curriculum vitae disclosure. Yes, recently people's immune life increased so much because of that. Spinal disease also moved from disc pathology to stenosis pathology. In spite of them, so much people of the degenerative spinal disease with the increased mean life because of that they need more minimized option of the treatment, especially like minimal invasive spine surgery and endoscopic spine surgery. Fortunately, endoscopic spine surgery developed during last 10 years, developed so much because of that. Before time, we discussed many discectomy treatment under the endoscopically, but nowadays it moved to the generation from the discectomy to stenosis without instability generation. Because of that, nowadays we can manage the more sufficiently of the endoscopic by the endoscopically to the degenerative spinal stenosis and the degenerative spinal disease. For example, this is my paper we publish, and in this paper you can see with the development of the generation of the endoscopic skills. First generation, the dissectum generation, and second generation is the dissectum and decompression generation, and nowadays the generation of the dissectomy decompression and fusion endoscopic fusion generation. And then now we can manage the more than 95% of the degenerative spinal disease patient with under the endoscopically without open surgery, and also can take a good to excellent clinical result. For example, we can nowadays we can measure easily like this patient. This patient is 78-year-old female patient with severe stenosis with combined with spondylolisthesis. In these cases, you can see some mild instability, not severe instability. How treatment will you choose for this patient? Yes. Anyway, the rationale of the endoscopic spine surgery is not only limited to the minimized option of the treatment, but also compared to the, because of that, the tubular decompression also already done the minimized option of the treatment. But endoscopic decompression can give three different special characteristics, like it has a more mobile and angled characteristics, and because of that it can approach more easily to the detailed point, and also the view of the operation is more deeper. Because of that we can manage the more detailed works under the more obscured area. And also this all process can perform under the fluid-based operation, and can we take a more clear operation field in spite of the most deepest point of the obscured field area of the operation. Because of that, this MR image taken 1 day after operation of the endoscopic decompression, then we can see the endoscopic decompression rationale is not only the minimized option of the treatment, but also there is sufficient neural decompression and preserve the functional segments, and also minimizing the paraspinal muscle damage and the less neural retract, and also finally we can increase the normal life activity. And the science base of this endoscopic decompression already published so many authors. And also the indication previously only limited some of cases, some mild spinal stenosis, and also some central, some lateral recess cases. But nowadays, with the development of the endoscopic techniques, in so many textbooks, they talking that the indication is near all kind of the spinal stenosis, in spite of the central stenosis, lateral recess stenosis, and foraminal stenosis, and far out syndrome can possible. But also there have some contraindication of such as more than grade 2 spondylolisthesis and remarkable instability, and like a neurologic damage state. Anyway, nowadays the endoscopic decompression can possible approach, can divide the two approach. One is the under the top technique, one is the over the top technique. But over top technique meaning that the outside in approach. It's like that. Anyway, before time, initially we came doing the inside out and under the top approach. But if we hope to expansion of the indication of for degenerative spinal stenosis like this very severe cases or thorax or cervical cases, hope to can possible under the endoscopically. I hope to recommend the outside in over the top technique. Then we can take a good to excellent result in spite of the so severe spinal stenosis cases. And also there needed some technical consideration of this outside in over the top technique, like it basic is the laminar drilling. Because of that, we should knowing these anatomy structures. And also if we hope to approach more deepest point, because of that the working channel sometimes bigger, but because of that we hope to approach more deepest point, we can change it small working channel using the switching technique like this. And the drilling is the very important point of this outside in approach of the over the top technique of endoscopic decompression. Like this. And also we should keep in mind this, because of that the purpose of the endoscopic decompression is the minimize the option and to preserve the facet joint. Because of that, to preserve the facet joint, we should keep in mind that the anatomy keep the medial border of the pedicle or medial upper tip of the superior process. Then we can preserve the facet joint sufficiently. And also one more important anatomical structure is that if we hope to over the contralateral side safely, we should know that these anatomical structures of the spinal laminar angle cranial to caudal. Unfortunately, this anatomy can see like this V shape under the endoscope view. Then anyway, we should checking these 3 viewpoints to overcome the contralateral side safely, like this. Sorry. But anyway, endoscopic spine surgery also have several complications. Among them, the most serious complication will be the dural tear. Fortunately, this dural tear can managed by the patch blocking dural repair technique. This technique already published in World Neurosurgery, and it is not difficult to manage under the endoscopically, because you should try this. You can see this cases 6 months follow-up, the patient have no problem. I will show finally some of cases. You can see this case is 80-year-old female patient with very severe cases of spinal stenosis. It can possible under the endoscopically. Also, this case is central stenosis, foraminal stenosis, and contralateral stenosis. In these cases, also can possible central decompression and possible to contralateral approach using the switching. After switching more small working channel, then we can solve this pathology by one step. And also you can see that this thoracic OLF cases also can possible endoscopic decompression. 1 year MRI follow-up see the well decompression, well sustained stability. And also some of cases of cervical stenosis can solved by the endoscopic decompression like this. Yes, finally, I will give the answer of the first question. This patient is a 78-year-old patient, female patient with severe spinal stenosis L3-4 and L4-5 instability. spondylolisthesis. I choose the endoscopic decompression for this patient and post-operative MRI, and 6 months follow-up X-ray cannot see more aggravation of the instability. Also, stenosis is still not where decompression state. In conclusion, take-home message. The indication of endoscopic decompression, stenosis decompression now expands the all kind of endoscopic spinal stenosis. And also there have some technical tips to give the outside in over the type endoscopic decompression, such as spinal laminar angle, sublaminar drilling, mobilization of the endoscope, and the contralateral approach. And anyway, after developing this endoscope decompression, nowadays we can possibly apply the endoscope lumbar interval fusion surgery, and so many widening of the endoscope indication of the endoscopic spinal surgery. Thank you for your kind attention.